Hi, everyone. Welcome to Kiwi College. I'm Sarah Smith, the editorial director of Kiwi, and I'm so glad you're all with us today to hear from Dr. Lawrence Rosen. Dr. Rosen is Kiwi's pediatrician columnist, and he's really our go-to guy for sensible, open-minded advice about healthcare. And that's because he's an integrative pediatrician, which he'll tell us more about. And he founded the Whole Child Center in New Jersey, which is a warm, welcoming, integrative practice that I think we will all wish we lived closer to after we hear Dr. Rosen speak today. Before I turn it over to him, I want to remind everyone that 3 of you out there in our audience are going to win a year subscription to Kiwi for being here with us today. If you already have a subscription, we'll extend it for a year, and we'll let you know next week if you're one of the winners. So, and after Dr. Rosen's talk, he's going to take your questions. So it's, like having a doctor right on call here today. So please feel free to type them in at any time while he's talking, and we'll get to as many of them as we can at the end. So now I'd like to turn things over to Dr. Rosen. Thank you so much for being here, and please take it away.
Thanks, Sarah. It's great to be back. I remember when we did the first one of these, it seemed like a long time ago.
Yes.
And it's always great to connect with the bigger audience out there. As Sarah said, I am a pediatrician. I practice in northern New Jersey in a primary care pediatric practice. One of the things that we do differently is practice what we call integrative medicine, and that's a pretty seamless blend of the best of conventional and alternative medicine. I'm going to take us through that. And when we were thinking of the topic for today, we're thinking about, in most of the country, spring is starting to spring, and think about creating greener healthcare for kids, and what that means different things to different people. So I thought I'd organize this by going through really from birth or even before birth through adolescence, and bring up a number of issues that parents and pediatricians can partner around. And that's really one of the big messages from today is no matter what your beliefs on health, I really think we need to create a better healthcare system where we are collaborating together to create optimal health for our kids. So we'll move right along. I usually like to start with a quote which frames the discussion. And this is from Dr. Abraham Jacobi, who in 1872 said in the context of a larger talk that the life and health of every infant are both economically and morally of paramount importance to society. And I think that Abraham Jacobi, for those of you who don't know, is really considered the father of modern pediatrics. Before he came along, there really was no field of pediatrics. Children were considered medically little adults and were treated as such, and he helped create a field of pediatrics. And really the philosophy and the value was that children are unique and special. And I think this really exploded from the 1930s to the 1960s. And today I think we've lost touch a little bit. Not that in conventional medicine, we definitely tailor our doses of medications and the types of medicine in the hospital that we provide, but as a philosophy, we've lost sight of the fact that the health of children in our society are of course important to these children, but they're actually of paramount importance to our entire society. And that until we start to pay attention to creating wellness for children again, we put our whole society at risk. So one of the concepts we had when I joined Kiwi as a pediatric columnist and the contributing editor was to create a space called the Green Pediatrician. Kiwi's part of their mission is growing families in a natural and organic way. That's also what I do in my practice. And we wanted to create health advice. Some of it's under a column called Ask the Doctor that's in every issue. We field and answer 3 different questions from a completely integrative perspective, a natural and holistic perspective. And some of those are posted on the website, which I've listed here below. And additionally, I write a blog that's meant to be monthly. Sometimes it's a little slower, but these are longer commentaries on issues or happenings in the world of pediatrics and medicine from an integrative perspective. I've written about things that are purely medical, things that are more about education, The most recent post was about the medical home concept, which is more about healthcare delivery, but they're geared towards families and parents. And we haven't had a lot of dialogue, but I really encourage you to write in and ask questions and further the dialogue when you can. And really check the site. We'll be updating it as we can and developing further. So I keep mentioning this term integrative medicine, and I've subtitled it the Whole Child Approach. My center in New Jersey is called the Whole Child Center. And when we speak about the whole child, it's really a philosophy of care that starts as follows. The philosophy is about not just the physical body, but mind, body, and spirit. And in integrative medicine, we do pay attention to the whole person and the interaction between these different areas, how the mind affects the body, vice versa, and an emotional and spiritual aspect to health that sometimes is overlooked. Family-centered care, and this means that not only are the children our patients, but the entire family becomes our patients, and the conversations and the relationships that we develop over time are not just with what we say the identified patient or that child, but really with the entire family. And I would even take it broader and say that it's not just family, but community-centered care as well. So that child's health as it relates to their family and community. We, of course, want to focus on wellness and prevention. This is a key distinguishing factor between integrative medicine and conventional medicine as it's typically practiced today. Healthcare, unfortunately, has become about disease care. It's about treating diseases as they happen. The system economically is set up to incentivize treating as many patients as you can, making as many diagnoses as you can, and providing treatments and procedures. We're trying to flip that around and say, no, really the system should be about creating wellness and preventive health care. Many pediatricians do try to follow this, but we really need to work to create an entire system that recognizes this. One of the things that I set out to do when I created my center was to make us a model of what we call ecologically sustainable health care. Not just that the environment has an impact on our health and our children's health, but how we practice health care has an impact on the environment, whether it's simple things like recycling, using less paper, thinking about ways to dispose of medicines properly rather than flushing them down the toilet. We have people who can bring their medicines or epinephrine pens for allergies back to our office so we can safely dispose of them. There are many aspects to that, but that's something that we value. Individualizing therapy, something you'll hear when I go through different ages and treatments are, it's not one size fits all, that the treatment for various conditions or preventive things like how we feed people, how we feed babies, is an individualized approach. We really try hard to work with families on a healthcare system that, of course, is safe and effective, but one that works for them, respecting their beliefs, their culture, and so on. And again, this leads us to what is truthfully a respectful collaboration, not only with families, but with all healthcare providers. If I have families who are also working with a chiropractor or a psychologist, with their teachers, we want to involve all healthcare providers in a non-patronizing, non-hierarchical system that recognizes that we'll be the quarterback and help those families coordinate their care, but that there's a multidisciplinary collaboration. And of course, as I've said over and over again, relationships are the key. No matter what type of medicine you practice and whether you believe in specific alternative practices or holistic practices, you don't have to believe in acupuncture or homeopathy to practice integrative medicine. It's about believing in individualized relationship-centered medicine. Really what we're now calling patient-centered medicine, or what I call family-centered medicine. So as I did mention, this is about going from disease care to health care. And I picked a nice picture from Kiwi, which really talks about mind and body. Really, if we can focus on children from the beginning and creating health, we'll have less disease to treat over time. This model, in part, in mainstream medicine, and it's what I just wrote about for Kiwi this month, is called the medical home model. And I only bring it up briefly, and you can read through the points here. These are values, as I wrote about in the article. If you could design a pediatric practice for your family, it would be all of these things. And these are all philosophies that really mean someone is working with you and your family in a compassionate, coordinated, family-centered, and accessible way. Some of this involves different therapies. Sometimes it's the philosophy of care. It's relationship-centered. It may involve the use of technology for accessibility. We maintain an active Facebook page, and we do webinars. We do different things to have patients have access to our care. So this is a concept you're going to want to become familiar with because it may influence the type of care that we develop in this country in the future. And again, I keep coming back to this, but it really is about partnering with families. This is a poster that was developed initially by several Canadian pediatric groups, including the Canadian Pediatric Society, and adopted by the American Academy of Pediatrics. And we have this hanging in all of our exam rooms in our office. It's available for people to use in their offices. You can order it, I know, through the Canadian Pediatric Society and I think also through the AAP in America. And it's a simple message. Talk with your doctor about all the therapies and remedies your child is using. And the visual message here, where we have things about chiropractic and acupuncture and so on, opens up the dialogue and says to people, you know what, it's okay to talk about all of these things. Now I'm going to take you through from the beginning all the way through adolescence and touch on a variety of issues that are models for the type of health care I've been describing. We've gone through the philosophy and the paradigm, and I'm happy to take questions about that at the end too. But I think that most people are interested in practical knowledge. What can I do? How can I work with my pediatrician or nurse practitioner or chiropractor or naturopath or whoever is helping me coordinate my primary care for my kids? What are some of the issues I should be aware of from the very beginning? And I can go back and say, to my healthcare provider, my pediatrician, hey, these are some issues I've heard about. What do you think? And you need to start to develop a dialogue about these issues, I think, from the very beginning. If you are working with someone who is not particularly open-minded, sometimes you can bring information to them and say, look, I know you may not agree, but this is something I strongly believe in. Can you work with me? And I found over the years that more and more pediatricians are starting to listen to their patients and get more education in certain areas, whether it's nutrition or some of these therapies we'll be talking about, so that even things like probiotics, which when I started doing this work, 15 years ago, 20 years ago, nobody really talks about. Now it's become much more mainstream. Many hospitals and pediatricians are prescribing probiotics for people who are on antibiotics. So we are slowly getting there, and it needs to come from you, all of you out there, to really continue to push the envelope. So when I talk to families prenatally, and we do run groups in our practice where a couple times a month we meet with prenatal couples and talk about issues. These are some of the things we start to talk about which will impact the baby's health from the beginning. Breastfeeding we are absolutely supportive of. There's more and more evidence and more policies coming out that say that breastfeeding is really not a luxury. It really is a health care issue. That being said, we do work with families individually, as I mentioned, and there are those that cannot or choose not to breastfeed. And we, of course, will work with them to provide the best nutritional plan we can for that baby otherwise. But we really do try to emphasize breastfeeding and make it possible for those women who want to breastfeed and may struggle through various times. We try to provide lactation support and medical support and just make it an environment in our practice where we are, again, supportive. And it's probably one of the most important health factors that one can do for their baby's health. Vitamin D. There continue to be numerous articles published about the impact of vitamin D prenatally and during nursing, and the impact that that has on the babies and the child's life throughout their entire life, that the mother's nutritional status plays a role in their physical and emotional health through adulthood. So that's an important issue, and make sure that you're talking to your, whether it's your OBGYN, your midwife, your doula, whoever's taking care of you, if you're pregnant, to talk about D3, measure your D levels, make sure you're in an optimal range, which now many people believe ranges from about 40 to 100 nanograms per milliliter. Many labs will measure below 30 as insufficient, but really even 30 to 40 may not be optimal. And some people believe in higher. We talk about this a lot during breastfeeding as well, that if moms are getting sufficient vitamin D, then the babies will as well. Omega-3s, essential fatty acids, are crucial for babies' neurological development. There's a lot of evidence now about nerve and visual development. But there are also research articles looking at reduction in allergies and food allergies, asthma, autism, a number of different areas where this may come into play. Probiotics, several very compelling studies about reduction in eczema and allergies in moms who take probiotics prenatally. The reduction can be up to 50% in some cases in high-risk kids. There are, of course, and all throughout these slides, you'll see what I call mind-body considerations, the impact that stress and coping with stress can have on various conditions. And I strongly believe that we should train our children from birth to develop a toolkit that helps them cope with stress. It should be part of our educational system. It should be part of our parenting, whether it's an organized practice like meditation or yoga, or it's more natural free play outside, exercise, music, whatever it might be, to cultivate that in our kids. And relationships are crucial. They have healing powers for our children and within our communities. So, and I've taken most of these pictures either from Kiwi Online or from my kids, which you'll see sprinkled throughout. So we're going to move forward. Our baby's born. In this picture, certainly sleeping comfortably. But something that happens shortly after birth, about 6 to 8 weeks in a subset of babies, is colic. And colic is really something that is an excessive irritability in an infant. And there's a wide spectrum. All babies cry. They cry a fair number of hours per day. They can cry for a variety of reasons, but there are those babies that just seem to cry an excessive amount. The theory about colic, which is the extreme end of the spectrum, and excessive infant irritability, is an adaptation. What Harvey Karp in his writings, The Happiest Baby on the Block, for those of you that are familiar, is called the fourth trimester, this 3-month extra time that's needed for the baby to adapt to life outside of the uterus. And you think about it, they're coming from an environment that is cozy, all their needs are provided for, they don't have to eat, they don't have to breathe, and they have to adjust. And some babies have an easier time adjusting than others. So there are many techniques. The classic advice for colic is, well, we don't know what causes it. There's nothing you can do about it. Just wait. By 3 months, it'll go away. But it can really wreak havoc on families' lives. And there are some very natural, safe things to do, whether your baby is colicky or just has periods of excessive irritability. And those include what we call the 5 S's, which, again, is from Harvey Karp's work. And those are things that a lot of us do intuitively, using swaddling, positioning, sucking. These are all very nurturing things for babies. There is more and more research that's looking at a variety of natural ways to help babies deal with excessive irritability. Probiotic studies have been impressive, both giving nursing moms probiotics and giving babies directly specific probiotics like Bifidus and infant strains. For those of you that are dairy sensitive, know that some probiotics, many are dairy related, so you want a dairy-free probiotic if you can help it. And using a variety of colony counts, you really need to work with your practitioner, but infant probiotics can be helpful with colicky behavior. Infant massage is a wonderful tool to learn for every baby. We teach it in our practice. Karen, who's a nurse in my office, has worked with parents on weekends for years now and helps train them how to do it at home. And we integrate essential oils and aromatherapy with that as well. There are various acupressure points, and in some societies, babies use acupuncture to help with colicky behavior, but there are some points that parents can be taught. And other manual therapies, such as cranial osteopathy or osteopathic manipulation, chiropractic work. Many of our parents are chiropractors or work with chiropractors. And there are many gentle manual therapies or energetic therapies that can help babies cope with literally the stress of adapting to their new life. These are some other things. It's hard to touch on all of the nutritional and herbal approaches, but certainly working with mom's diet if she's nursing. Dairy can be an irritant to babies. Other elimination diets can be effective. Gluten and wheat products. It can be other food irritants or allergens, processed foods, dyes, additives, sweeteners. We really try to work on a healthy diet for mom, and that can help the baby. Or if the baby's formula fed, working on non-dairy options or other approaches. There are herbals that have been studied. Chamomile tea is a very safe way to go. Just giving an ounce or two several times a day, 2-3 times a day to a baby. That can either be directly, sometimes moms will drink it and nurse through. Fennel tea, gripe water, which contains a number of herbs, including fennel and ginger. And again, you want to be careful with the overall volume amount of water. You wouldn't want a newborn drinking 30 ounces of water or tea a day, but a few ounces here or there can be quite effective. Some people prefer to use homeopathics, which can include chamomile, homeopathy as a whole, talk in and of itself, but using extremely dilute natural substances. There are a variety of fussy baby or colic baby preparations, and these are considered safe. Energy work like Reiki can be quite effective, working with parents and with babies, and really working on parental stress, I find has a big impact on the baby's irritability. Meditation, yoga, other mind-body approaches for the baby and you. Let's move forward to vaccines, and I think this is something we'll probably have several questions about. I find when I do groups with parents, this is, of course, the hottest topic, and it will continue to be for a long time. I call it the third rail of pediatric politics, which is why you have the picture here. And the reason for that is it's like many political hot topics. In conventional pediatrics, there's really not any safe way to talk about it. It's really not okay to talk about in an open way in academic pediatric circles. There's really an assumption, unfortunately, that unlike other medicines, and I really think of vaccines as a pharmaceutical or medical intervention, one that can have profoundly positive impact for some children and negative impact for others, that there should be informed consent decisions and risk-benefit analyses done with the family. Just so you know where I'm coming from, I do believe in vaccines in general. My children are vaccinated. But that being said, I don't believe all vaccines are created equal, and I don't believe that my health beliefs necessarily apply to your children, and I think it needs to be a discussion. So lately in the news, you've been seeing headlines like this coming from Fox News and others that physicians are firing their patients for not vaccinating. That more and more, there was a survey done recently through Contemporary Pediatrics that showed that almost 50% of pediatricians have fired their patients for not vaccinating. It's a very complex ethical topic. I do not believe in this. I believe everyone deserves access to good health care, but this is something we need to talk about in our society. These are the AAP statements on ethics. They're very clear that the first choice should not be to discharge patients from practices, that families with doubts about immunization should have access to good medical care. And when I was asked about this topic, there was a debate for U.S. News & World Report with a more conventional pediatric infectious disease doctor, and I took the side of flexibility in vaccines. And this is the quote that I gave, which is really about encouraging discussion. And I think that's really the main point here. As we get older, looking at infant feeding and starting solid feeding somewhere between 4 and 6 months, there's even a debate about the timing of starting solid foods. When? What's the best time? We have families who culturally They'll say, my mother told me that she fed me when I was 2 or 3 weeks old, and we started with this food, and that's what we do in my culture or my country. Is that safe? Ranging to people who want to really work on baby-led weaning and starting with actual foods when babies are older, and that can be 6 to 9 months or later. How safe is the latest to wait and exclusively breastfeed till the babies are 12 months or so? And so we have discussions ranging on this, and there is emerging science that simply says at this point in time, starting solid foods other than breast milk before 4 months seems to be associated with more food allergies and allergic disorders. And in some cases, starting later than 9 months, there was one study of introducing gluten after 9 months, which showed an increased risk of celiac disease. It was one study, and it hasn't been replicated. But there seems to be a timing issue. So most of our families start between 4 and 9 months. I would say on average between 4 and 7 months. And honestly, it really depends on the individual family preference and family allergy history when parents start. So then if you say, all right, well, I'm going to start at 6 months. What do I start with? There's been a shift in that as well. Historically, most babies have started on white rice cereal. And I don't have to mention the brands. I think we all know who they are. And that is basically feeding your baby a refined white powder that has no nutritional quality at best other than being supplemented with iron and zinc. And at worst, may be a risk factor for health issues later in life like diabetes. It is clear to me that natural fruits and vegetables, organic when possible, locally grown when possible, make your own if you can, healthy, fresh, non-processed produce is the most interesting food and tasty food for babies and probably the healthiest to start with. I don't personally have a preference to fruit or vegetables first. I like to pick seasonal things. You can simply puree any fruit or vegetable you want and start from that. Start once a day. There's no rush. Starting feeding with babies isn't about filling them up with food. It's about teaching them to enjoy eating. There are a variety of perspectives about grains. They don't have to be limited to white rice cereal. In fact, I would recommend other grains like quinoa or millet or brown rice if you choose. I usually wait till 6 months on those foods, although sometimes we do start as early as 4 months. And they should not be the bulk of the diet. Proteins, many people are doing earlier introduction of proteins, whether those are meat or vegetable proteins. It is absolutely okay to raise your baby as a vegetarian. We do have some vegan families. That's challenging, but possible. But certainly vegetarian babies are much more common today and certainly easy to provide vegetable proteins. Typically, we start around 6 months or older. And fats, it's very important to make sure we're getting omega-3 fats, whether from diet or supplements. Moving along, in the 6 to 9 month range, we start to deal with teething more and more. There are a variety of teething supplies now that are BPA-free, and if you don't want to use plastics at all, there are wood teethers. But really, any kind of just a washcloth with wet water or frozen works well to let babies chew on things. Some people feel more comfortable with that. They just like to gnaw on things. Sometimes it's your finger. Some people use clove oil for teething. I would be cautious with clove oil. It's quite powerful. Anywhere from a drop to 4 drops diluted in some olive oil or other carrier oil, and you would rub on the gums really not too frequently. I would say no more than 2 to 3 times a day. But you really must dilute it. I wouldn't use straight clove oil on a baby's gums or skin. Homeopathically, there are many blends, and just straight chamomile, which is a homeopathic blend, chamomile, a dilution of chamomile, tablets, solutions, gels that can be quite effective for teething. This is a picture of my son learning to walk, moving into our 9 to 12-month-old period and even older. Lots of cold and flu issues that have come up, and we have a whole webinar on this that we did previously for Kiwi, so you can look at that for more detail. There's a lot of evidence now about vitamin D and probiotics for flu prevention. Chicken soup, it turns out, has factors in it that help with the common cold, but hydration and electrolytes like sodium and potassium are key with colds and flu. Elderberry syrup, wild elderberry, has been shown to be quite effective both in the lab and in people for flu treatment. Vitamin C, not mega doses, although some people still believe in it, but just making sure you're incorporating vitamin C and other antioxidants in your diet or in small amounts through supplements. Homeopathics, there are a wide variety of homeopathics that are very safe alternatives for cold and cough and flu symptoms. Essential oils through aromatherapy, eucalyptus, mint. Some people use lavender or chamomile for calming. But to help open up airways, eucalyptus and mint oils can be quite effective. And saline or neti pots. Make sure if you do use rinses in the nose, especially with neti pots, you're using distilled or purified water with sea salt, not with table salt. Toddlers. I want to make sure we leave plenty of time for questions, so I'm going to try to finish up in about 10 minutes here. The issue with toddlers that I wanted to bring up, and there are many fun things about toddlers, but sometimes we deal with health issues that are particular. Now we see ear infections in babies, of course, from a few months old, but we see ear infections running through toddlerhood. One of the questions with ear infections is, what's the root cause? Rather than just treating, again, as we mentioned, just treating diseases as they happen, what's going on? Why is, many children will get one ear infection, but is it because they have a cold, which has led to congestion, and they developed an ear infection? And I'm talking about middle ear infections, otitis media, which usually come from congestion in the nose predominantly. It could be from teething. We definitely see an increase during teething periods. Allergies, and that can be allergies to foods like dairy. When I have children with chronic ear infections, we do dairy elimination diets, or allergies to environmental environmental toxins. Cigarette smoke, for example, can be a significant source of irritation to the respiratory system, and that can create congestion, which will then lead to ear infections. I would say that not as many people smoke as they used to around children, but grandparents may, parents may, and sometimes it's even smoke on what we call third-hand smoke, smoke from other inanimate objects, couches, clothing, things that can affect children in that way. I would say that pain relief for ear infections in general is key. Treating the actual infection, sometimes the body will take care of itself often. And what we're treating are pain symptoms. And so there are many more effective remedies than antibiotics for pain relief. Several studies have shown that herbal ear drops, like garlic and mullein oil and an olive oil base, can be quite effective for ear pain and they do have antiviral, antibacterial, antifungal properties. So we use those frequently as a first-line agent. Lymphatic massage, doing massage of the lymph nodes around the neck area and behind the head, often using oils like lavender or more soothing oils. And osteopathic or chiropractic manipulation can be helpful for children with chronic ear infections. School-age children, they're off to school on the school bus. These are kids who tend to get what we call all the first aid things. Bites, I have bites listed. I meant to be on the slide: bites, burns, bumps, and bruises. But now we have a lot of bites. So I want you to think, when you think about first aid, about homeopathy first. There are several things we do for bites, burns, bumps, and bruises. Ice sometimes can be quite effective, but two particular homeopathic remedies, Arnica montana and Apis mellifica, can be helpful. Arnica more for your bumps and bruising, and Apis for your bites. For burns in particular, I like aloe vera, straight aloe vera gel, and one I didn't list, calendula, ointment or gel or cream can be quite effective for burns or soothing skin as well. Using things like Rescue Remedy, which is a Bach flower essence, or aromatherapy to help children calm down. There's a huge anxiety component around these these issues, and sometimes that can help, especially if you have a child who gets repeated injuries. So really you want to think about homeopathy and topical gels and herbals first with these approaches. And it's great to have a first aid toolkit where you can put together a variety of substances that you can have around. Adolescence. This is a picture of my 13-year-old son climbing outside. And the reason I show this picture is stress. Our kids today are exposed to so many environmental factors that create stress that, again, as I mentioned early on, we really need to help them build their toolboxes to cope with stress. Stress is a true mind-body illness. Our children, whether it's through technological reasons, social media, more screen time, texting, more schoolwork, more scheduling, we're seeing more and more children with physical symptoms, headaches, stomach aches, heart palpitations, shortness of breath, ulcers that are symptoms, somatic symptoms of stress-aggravated illnesses. The first thing we want to do is pay attention to lifestyle factors in all areas, home and school. Those are nutrition, fitness, rest and sleep, and mind-body approaches. And so I show this picture of him climbing around the rocks. Getting outside into nature is one of the most effective ways to de-stress. That connection to nature that we've lost. If those of you that read Richard Lou's books, Last Child in the Woods, The Nature Principle, more and more pediatricians are partnering with wildlife centers and nature centers and national parks to prescribe nature. Get kids back out with free play into nature. Find national parks or wildlife centers near you. Get out in the woods, take a walk, connect to nature. That will help children immensely. And that goes along. There are other mind-body approaches. Some kids like yoga. We do a variety of things in our practice that are therapy-driven, biofeedback, hypnosis, guided imagery. These are things we can teach kids to go back home and develop control over their physical symptoms. More and more adolescents are getting interested in meditation. Whatever it is, whether it's exercise or music, some way every day that they can unplug and find some time to decompress. And rest and sleep, can't emphasize enough. I talk about it every day with our tween and teen kids. It's always the parents who want the kids to get more sleep and the kids who don't get enough sleep. Your average teenager probably needs at least 10 hours of sleep, and none of them get that. 8 hours is an absolute minimum, and they need downtime. That's why I put in rest as well. So in the last couple of minutes, I just wanted to list some resources here for you. Kiwi, as I said, we've been developing this Green Pediatrician site online. We welcome suggestions. Send in questions for the magazine to Sarah and to the magazine so that we can answer your questions. Blog ideas, I'm always happy to hear about. You can always email me through Kiwi. The American Academy of Pediatrics, which is a large, fairly conventional organization, but it has over 50,000 pediatricians, I think, now, and more interested in integrative medicine. We formed several years ago a section called the Section for Integrative Medicine, for Complementary and Integrative Medicine through the AAP. We have well over 100 pediatricians, which doesn't sound like a lot, nearly 200, I think, at this point, who have joined our section. And so more and more pediatricians have interest in this area, and you and they can look at resources on our website. The Holistic Moms Network, which is developing throughout the country, has chapters near you, hopefully, that you can join with other holistic parents. I know that they welcome dads as well. And they have an annual conference that's wonderful. They were on the West Coast last year, East Coast the year before, but there are chapters near you, great way to connect with other holistic parents. In my practice, I listed here really just for the resources. I try to keep resources, articles, different things in the news on our resource page. So if you're looking for connections, that's another way to gather resources. So I know I went through a ton of material in a short period of time, but I wanted to leave a lot of time for questions. Sarah's going to be filling the questions, and she'll present them to me, and I'm happy to answer as many as you have. So thanks for listening, and I'll turn it over to Sarah.
Thank you so much, Dr. Rosen. This has just been so interesting. It's really great to hear your perspective on all of these different ages. So thank you for the great presentation. And we're getting a lot of good questions coming in, so send them in, folks, and we'll get to as many of them as we can. Let's start with, I actually just want to answer one person's technical question for everyone, that if you missed any part of the presentation or you just want to have it later for reference, it'll be up on the Kiwi website, kiwimagonline.com/college for Kiwi College, and it'll be up there, and you can watch it anytime you want. Okay, so let's start with a question from a vegan family. So this listener wants to know if you know of any supplements of D2, back when you were talking about vitamin D, for children other than fortified foods. And she says she's taking D2 and nursing, but would like to find a ready-made source for my older 2 boys.
Sure, that's a challenging question. And the first thing I would say is supplemental vitamin D should be D3 in most cases. I know there's some confusion about D3 and D2. I do believe that vitamin D3 is what you need to get. And outside of supplemented milks or dairy sources, and there are milks made from things such as almonds, coconut, that are calcium and vitamin D fortified, but there are just not that many foods other than that contain large amounts of vitamin D. Sunlight continues to be the best way to get vitamin D and will drive up your D levels. The challenge is, in many climates, to get enough sunlight year-round, and we use sunscreen more and more than we ever have to protect against skin cancer. I do think, especially when the sun's not at its hottest, and for at least 15 minutes a day or 15 minutes twice a day, try to get some unprotected sunlight. It's probably your best bet no matter what your diet is. And the one thing I would just add about vegans, I don't worry as much about vitamin D as I do about B12. Vitamin B12 has to be, it's very difficult to get from non-animal sources, and so whether you use supplements to do that, you just have to pay attention to that.
Oh, that's good. I'm glad you brought that up as well, Dr. Rosen. One last question about vitamin D3 from someone. Does it need to be taken separately, or can it come from a multivitamin?
It can come from a multivitamin, but the amounts in most multis are small. So the recommendations for dosing for babies are now 400 units, and the Institute of Medicine, which recently looked at that, really didn't recommend much more than that until you get to 600 units for children and adolescents, maybe 1,000. I find that many people, when we measure levels, that 400 units might be adequate for a baby, but for a young child or adolescent, certainly for adults, it's not enough. And most multis come with 400 units at most. Some of the adult multis now are coming with 1,000 units. The best way to check is to check your vitamin D level and to know where you are, but in the absence of that, most adolescents and adults need 1,000 units minimum, many 2,000 plus. So it would be safe to take 1,000 to 2,000 every day without really worrying about it unless you have some underlying metabolic condition and you want to check with your doctor. So you may need to supplement, but if your multi has it, that's fine.
Great. Okay. We have a question about babies, toddlers. What age, when can you start giving kids homeopathic remedies for cold or flu, or topical homeopathic remedies? Can you address the age issue especially?
Sure, that's great. And one of the great things about homeopathy is you can start at birth. It's safe to use during pregnancy. Homeopathic medicines, because they are incredibly dilute natural substances, really are felt by those of us that use them to not have any serious adverse effect and no contraindication at any age. So for young children who, look, I mean, in the perfect world, we're talking about colds and coughs, if you can let things run their course and hydrate and feed and keep your kids healthy, that's great. Let the body do its thing. But we all know that kids have symptoms that bother them and get in the way of them. They're eating or they're sleeping or they're just miserable. So it's nice to have options that are safe. And compared to most over-the-counter traditional or conventional cough and cold remedies, homeopathic medicines can be used at any age. They can be given frequently. Most of the remedies are given even every 15 minutes to every hour in the beginning for symptoms, and you don't have to worry about interaction with other medications as well.
Are there some resources you could recommend to learn more about homeopathy? We have a question about someone interested.
Yeah, sure. And I do want to, there's one thing I should correct, is there are some homeopathic cough medicines that contain honey. And it's important to know that we don't recommend the use of honey-containing products in children under a year. That has nothing to do with the homeopathic itself. It's just that it comes with the medicine. So I do want to give that caveat. As far as learning more about it, there are more and more resources for parents. They're usually through the manufacturers of homeopathic medicines, and there are a number out there, Hyland's, Boiron, several of them, Humphreys, et cetera. And so they often will provide, I know that Kiwi, that we've done some various webinars about allergies and colds that include stuff about homeopathy. I think through the, you can tell me if I'm wrong, but through the Moms Meet groups through Kiwi, that there are chances to learn more about homeopathy?
That's right. The Moms Meet groups, which you can find out about at greenmomsmeet.com, get some great education on these topics and get to sample a lot of the brands too. So people should check that out.
Yep.
Another question about babies. You were talking about food, some of the best foods to give them. Can you tell us about foods that you should really avoid when you start feeding?
Yeah, you know, the interesting thing with foods and food avoidance, we're usually talking about proteins. You know, when should I start nuts or introduce nut products? Or what about drinking cow's milk or eggs or wheat or gluten? A lot of that's been turned on its head. We used to think that early introduction was bad and led to more allergies. And as I mentioned, there's a timing question, and it may be that introduction of some of these highly allergenic foods, small amounts, earlier than we thought, even 6 to 12 months, may prevent allergies. So there's still a lot of research going on. I think today most pediatricians don't recommend highly allergenic foods. Those would be peanut and nut products. And those are different. Obviously, peanuts are not tree nuts, but tree nut and peanut products, in most families, we wait till a year or older. Drinking cow's milk is not, if you do choose to do that or give it to your kids, not until a year, although yogurts or cheeses can be given earlier than that, usually as early as 6 months. The other food, shellfish, typically not till a year. And again, sometimes we modify this. If we have parents who are allergic or siblings who are allergic, we may wait longer. Whether that's the right thing to do or not, research hasn't shown us yet. There's issues on both sides. Honey, as I mentioned, should not be given under a year. The timing of grain introduction and gluten is still debatable. Most people certainly say not before 4 months, but that's usually introduced between 4 and 12 months. In terms of other allergens, eggs, many people now do feel comfortable introducing egg products before a year. There used to be a debate about egg white versus egg yolk, the white being what contains most of the protein. I don't think any longer there's any need to separate that out. Honestly, unless you have a micro separator, it's kind of hard not to get the white and the egg mixed up together. And a lot of people feel comfortable starting at 6 months. Again, you have to pay attention to your family history. And I think that covers most of the main allergens.
Okay, great. Moving on to questions about specific kinds of natural remedies, we have someone who's wondering about elderberry that, she started giving it to her 19-month-old, she said, with the first signs of a cold. Is that something that you can give regularly?
So that brings up a really good question, which is about herbals and, what do you give preventively and what do you give as a treatment, and right. Some things are both. So elderberry, which is a berry, it's really a food-based herbal, assuming you're not getting a mixture with other additives, really can be given to any child who's eating fruits. If you think about it, it's really fruit-based. Some people make their own elderberry syrup, but if it's just elderberry, so really 4 to 6 months and older should be reasonable. The studies on elderberry and for research have only looked at treatment per se, and specifically flu treatment. So at the first signs of flu or colds, to start giving it, often 3 times a day, 2 to 3 times a day. However, people have asked me, can I give it a small amount every day as a preventive regimen? There's no reason to think that's dangerous. Again, it's a food. You know, if you gave elderberry as a fruit instead of plums, you know, you could feed that to your baby. So I think a small amount once a day would be reasonable. I don't think it would have the same impact as if you were giving it 3 times a day for flu symptoms. And I definitely recommend for those that give it every day to bump it up to 3 times a day when the kids are sick. So there's not data, but I do think it's safe.
Interesting. Speaking of natural remedies like that, someone wrote in who says that her child has a very itchy scalp, and they've even tried prescription medicines, and nothing is working. Is there something herbal, homeopathic, natural that you think that is worth a try?
Yeah, we didn't really talk about skin conditions too much. The most common, itchy scalp, which, can lead to dandruff or flakiness skin, can come from eczema, seborrhea, number of conditions, usually resulting from inflamed dry skin. And whether that's cradle cap in babies, dandruff in older kids, eczema in all age kids, the key to a lot of that, there's both topical treatments and internal treatments. So topically, we found a lot of oils, olive oil or coconut oil in particular, can be very effective as a moisturizing agent for the scalp. For older kids, you can use a natural conditioner, a non-chemical hair conditioner, because that will moisturize the scalp, or natural shampoo conditioner combinations from organic companies, and letting that conditioner sit on the scalp for a couple of minutes, which is hard to do in a kid, but sometimes that helps. Internally, I find that paying attention to omega-3 in fish oils or vegetarian options that come from algae or flax oil can improve hydration of the skin in general. So that's another thing to think about.
Great. Dr. Rosen, we are getting so many questions about kids who have a hard time sleeping. I mean, we have from a mom of a toddler, 5-year-old, 8-year-old, adolescent. Can you offer some tips for, so what the different questions are, for calming the mind, for is melatonin safe, are there homeopathic remedies? What can you do to help all these parents whose kids won't sleep?
I think we're raising an entire generation of sleep-deprived parents.
Yeah, sounds like it.
And I can tell you, that is the #1 question in our office every day with every encounter from babies through adolescents. And we probably should do a whole webinar on sleep.
We should.
But quickly, what I would say is this. Sleep, you got to start with lifestyle habits from an early age. Children need to learn how to go to sleep. And I'm not talking about sleep training necessarily, but being calm, having a routine at night that is calming and centering, where they're not going, when they're older, from watching TV, turning the TV off and trying to go to sleep right away. It's overstimulating. They need downtime. You need to create a routine that is calming and soothing for your kids. A lot of people may have tried that already. I think from a natural perspective, paying attention also to avoiding snacks or things that have artificial sweeteners or processed foods, trying not to eat too late or drink too late in the night. Again, winding down. There are some natural homeopathic aids or herbal aids that it can include things like Rescue Remedy, which is a Bach flower essence, chamomile or chamomile tea. Then some people rely on herbals or supplements like melatonin. Not a lot of data on long-term use of melatonin, and the dose is debatable. Some people now are using smaller doses, like a 0.5 milligram or so. We don't generally recommend it for very long-term use just because we don't have data, but short-term that can be effective. Valerian root is a very powerful herb that's more of a sedative, but has been used successfully in kids with significant anxiety. So those are kinds of things you definitely need to talk to a healthcare practitioner about, but might be options for you. But I find paying attention to the lifestyle issues is probably the most important thing.
Great, great. Let's move on. We have a question about vaccines, not surprisingly. But actually, this question is about the Gardasil vaccine. If you have an opinion on it, or how you talk to your patients about that, if you recommend it, or what are the considerations for people in deciding?
Yeah, so with adolescents now, and now the recommendation for those who don't know about Gardasil, it's the human papillomavirus vaccine, extremely controversial among not so much among pediatricians, but more so in the holistic health community. People that are wary about vaccines to begin with feel that this is a vaccine that, my child can't catch this casually, that it's not something that's airborne, the HPV, the human papillomavirus. So vaccine was developed for young girls, adolescent girls, to prevent. You have to get the vaccine before you've been exposed to HPV, which is during sexual activity. Now it has been approved and recommended for boys as well to limit the infection rate in boys so they don't spread it to girls. HPV can cause cervical cancer in some strains. Not all people that get HPV develop either genital warts or cervical cancer. There's a debate about whether the vaccine actually long-term is the best strategy to prevent these disorders, or continuous surveillance and pap smears is the most effective by itself. It doesn't replace those things. There's been a lot of criticism about potential adverse effects ranging from severe neurological effects. I am wary about the long-term safety and effectiveness issues at this point, and really would like to see more evidence before it's widely introduced as a policy. I can't really answer. It's really an individual question beyond that.
That's interesting, though. Interesting. So we have just a few minutes left, so I want to try to get to some different things. We have a question about colic. Are colic and acid reflux the same? And if not, are there ways, homeopathic or natural ways to treat acid reflux? And so this question was interesting because this person's child was taking a prescription, it sounds like, but then the insurance company decided it's not necessary, which is, of course, an interesting and tricky situation. So what, what can a person in that position do, or people who just don't want to be taking prescription?
Well, the first thing I would say is a number of issues. One is colic is just a description of excessive irritability, which can be caused by a number of factors, including what we call gastroesophageal reflux, reflux of the stomach contents back up the esophagus. Reflux in babies is a very different issue than reflux in adults. It is not always a disease or disorder. All babies reflux to some degree, and the question is the refluxing of that contents causing the baby distress? We typically don't treat spitting up in babies unless it's causing an issue with weight gain or severe irritability. So if a baby's colic, you're irritable, to one of the considerations. Reflux is hard to diagnose because all babies spit up. Really, is your baby more excessively irritable with and after feeding? That's usually a tip-off. We start working with maternal diets, eliminating dairy if the moms are nursing, or switching formulas if the babies are having issues. That dietarily, that's the first thing to look at before you get to medication. There are a number of homeopathic and herbal approaches. Positioning, during and after feeding can be helpful to keep upright. And one of the last resorts is medication, things that are Zantac or other acid blockers. I rarely use them. I don't think there's much of a concern about long-term safety with that, but I really like to try everything else first. So there are a lot of different options. Interesting that the insurance wouldn't cover it,
right,
but that's a whole other issue.
Right. Let's talk just briefly, if people can, stay with us if you'd like to hear the answer about this one, about a little bit more about vitamin supplements. We have a few questions about what's a good multivitamin for different ages, for teens in particular, if that's that might be an issue for some people. But also just, how do we know, like we have one question, someone's wondering about whether their child is getting enough vitamin D and calcium because the baby isn't, drinking dairy or having any dairy. So how do we know what supplements our kids need, and how do we find good ones? I think
sure. Well, there's a
supplement
industry, right?
And
right. I think sometimes we think, oh, well, they're natural, so therefore they're safe. And I know Kiwi just in a recent issue did a thing on sort of parents' top choices of supplements, and there was an article there that I think I mentioned in the article that certainly food is our best source of vitamins and nutrients. There's no replacement for that. So supplements and vitamins are outside of healthy nutrition, and sometimes they're a necessary safety net, if you will. Some people use multivitamins for their kids because they're particularly picky eaters, or they have certain restrictions in their diet and they want to make sure they're getting enough. So I don't think that vitamins are necessary for all kids. That may be changing in terms of supplements with vitamin D, which if you can't get enough from your diet, or sunlight, or with omega-3s, if you don't get enough from diet, those may become essential nutrients that we can't get through our foods effectively. But other than that, a multivitamin is not necessary for all kids. Parents tend to use them, again, when they want to have a safety net or have particular picky food issues. As far as other supplements, herbals in particular, look, there are some things that have been used over centuries and generations. Drinking chamomile tea is an herbal remedy. The most common herbal remedy around is probably coffee for most adults. There are things we just do that we wonder, chocolate is an herbal, which can have wonderful healing properties. So, I think as far as taking in supplement forms, when possible, try to get things from food. And as far as choosing sources of supplements, it's hard. I mean, the regulation of the industry is different than pharmaceuticals, and you need to learn and gather resources about who you can trust.
Great. Let's finish, Dr. Rosen, if you could share with us, I figured we'd get a question like this, and I was going to ask it if we didn't, but is there some way for all of us out here to find a greener healthcare type of doctor, if we can't all just, come over to your practice? Can you give us some advice on finding one, or on,
sure.
Telling your doctor maybe that you have already about your interest in these sort of issues?
Yeah, this was another Q&A that we did in a recent QE magazine that came up. How do I find a green pediatrician?
Yeah.
Look, I'm always happy to get calls from all around the country, asking for people who want to come in, but it's not practical, and we do need to train, more and more pediatricians. So in the meantime, there are some resources online through the American Academy of Pediatrics website. I put on our section. There's a link for parents to look up geographically pediatricians who identify themselves as being integrative. You have to do your homework and go and call them and visit them and see if they fit what you're looking for. But that's one resource. Also, there are a number of websites online that talk about either green pediatricians or vaccine-friendly pediatricians. Sometimes it's a euphemism for holistic pediatricians. The Dr. Sears website has that. So it's tough. I think, there's not like a one list online somewhere. It's really about hearing from friends, asking around, asking the questions. And that's what we put in the Q&A was, asking certain questions about vaccines, about nutrition, about complementary and alternative remedies to see if it's a good fit, and helping to train your pediatricians. Sometimes you've got pediatricians who are more open-minded than you think and are open. When I started years ago, it was patients who first came to me and educated me about many of the things I'm talking about today. So we learn from all of you out there, and don't give up on your pediatricians out there. You definitely can work with them.
I think that's a great point, to be reminded that if you can find someone who's open-minded, then you can really work together, and that what the things we all care about so much and read about in Kiwi and talk about with our friends, we can bring that up. Find the right personality match.
Certainly, until then, we're happy to be your virtual green pediatrician.
Great. Thank you. Well, I think we will leave it at that. Thank you so much, everyone, for being here today. We'll let you know who the winners are of the Kiwi subscriptions next week. But Dr. Rosen, I really can't thank you enough for all the really great information. I think we all learned a lot today.
That's my pleasure. Thanks, Sarah.
Thanks, everyone. Have a great rest of your day.